Welcome to the Rocky Mountain MS Center's webinar series, Maximizing Lifelong Brain Health in MS. Today's topic is helping others understand MS. This presentation features Alyssa Berlinger and Kelsey Lance. Alyssa Berlinger is an MS educator and licensed clinical social worker. She has been involved with the Rocky Mountain MS Center since 2010, after she was diagnosed with MS. She received her master's in social work from Smith College School for Social Work, and she completed a 2-year clinical fellowship at the University of Colorado Boulder. She teaches MS 101 with Kelsey, and she provides therapeutic support for individuals, families, and loved ones who have been impacted by MS for the Rocky Mountain MS Center.
Kelsey Lance is the education manager at the Rocky Mountain MS Center. She enjoys working with the doctors at the Rocky Mountain MS Center at CU to provide educational conferences, webinars, classes, and speaker events for individuals and families throughout their MS experience. Kelsey received her bachelor's degree in communication and history from the University of Colorado in 2007. After a year in the AmeriCorps NCCC program, she has continued to work and volunteer with nonprofit organizations.
We would like to thank the pharmaceutical companies who have provided patient education grants to support this series. Thank you to Genentech, Biogen, Celgene, and Novartis. This webinar is scheduled for 1 hour. The first 45 minutes will be the presentation. If you missed something on a slide, we will be archiving this webinar along with the slides on our website at mscenter.org so you can replay it at any time. We'll reserve approximately 15 minutes at the end to answer questions from the audience. You can submit questions at any time during the hour by typing them into the chat window on your screen. We will answer as many questions as time allows. With that, we'll turn it over to Alyssa.
Welcome today, and thanks for joining us as we really try to help others understand what MS is. Let's get going. What we know about MS has changed a lot over the years, and the disease presents differently for every single person, so it's often difficult to explain to people who do not have it. To further complicate things, many of the symptoms of MS are invisible or variable, meaning they will present one day and not the next, making it difficult for others to know how you're doing at a particular moment.
The purpose of this webinar today is to help explain some of the basics of what MS is, how what we know has changed over time, and some of the commonalities of experiencing MS. We hope that people with MS can share this webinar with others to help them understand the MS experience. So Alyssa, what exactly is MS?
MS is a disease that impacts the immune system and the central nervous system, two of the most complicated systems of our body. The immune system is divided into two parts. Our innate immune system is the part of our body that knows how to respond to outside threats. For example, think about what happens when we get a splinter. It turns red, it gets inflamed, it gets pussy. It's our body automatically responding to some foreign object saying, I need to get rid of this thing. The adaptive part of our immune system, on the other hand, is shaped by our experiences and the environment. This is the part of our immune system that responds to vaccines. Once it experiences a small amount of the foreign invader, we'll be able to write a defense code. And when that foreign invader comes back in, it creates a memory that can be quickly called upon and be able to get rid of this foreign object and foreign invader. The central nervous system is made up of the brain and the spinal cord. This includes the optic nerve, which can also be impacted by MS. In the brain, we have gray matter, which is made up of neurons or our cell bodies. These allow us to think, see, hear, speak, feel, and move. We also have white matter, which is made up of our axons or our myelin-covered nerves. And the white matter is what shows up in MRIs.
One of the inventions that helped further our understanding of MS was the MRI. It was not used for brain scans until 1984. Until then, we could only look at the brain autopsies of people who had died with MS and the symptoms people who had MS reported. Right after we were able to see inside the brain with the MRI, the NIH, the National Institute for Health, dedicated a lot of funding to brain research, and so the 1990s became the decade of the brain.
In MS, we think about the immune system getting bad information. parts of the immune system are attacking the central nervous system as if it were a foreign invader. The weapon of choice of the immune system is inflammation, which in this case causes damage to the central nervous system. One of the things that we think about is our immune system is going rogue, but in a very specific way. One of the things that is impacted is the myelin. Myelin is the fatty substance that surrounds and protects our nerve fibers of the central nervous system. Myelin helps the nerve fibers conduct electrical impulses from one part of the brain to the other. When the myelin is damaged, those impulses are disrupted. Areas of myelin damage are known as lesions or plaques, and these will scar over, hence the name multiple sclerosis, which means multiple scars. And when they scar over, they create little areas of water. The water is what's picked up on an MRI. MS can also cause destruction of the entire nerve. The damage from lesions disrupts the transmission of nerve impulses from the central nervous system to the rest of the body, causing a variety of symptoms. It's important to note that MS is just not a disease of the myelin. It attacks all parts of the central nervous system, most importantly, the nerve cells.
Thankfully, our brains have an amazing ability to compensate for a certain degree of injury. When one area of the brain is damaged, there are often other pathways that a nerve impulse can take. However, some of these pathways may take longer. This is why up to 90% of lesions in the brain and 30% of lesions in the spinal cord produce no symptoms. They're subclinical or asymptomatic because the brain has rewired around the damage before symptoms could occur.
Many MS patients experience quiet periods when the disease is relatively dormant, but they may still be coping with one or another or number of symptoms that aren't apparent always to the outside world. When this happens, patients can also experience periods where the disease is quite active, which we know as exacerbations. During exacerbations, symptoms can be more pronounced, but usually subside and sometimes go away entirely soon after an exacerbation. Other patients may not experience dormant periods and instead live with the constant symptoms or a more progressive worsening of the disease. MS can sometimes lead to disability depending on a multitude of factors. And some of those more so have to do with where lesions are located for certain individuals than necessarily the number of lesions individuals have.
So one of the factors that impacts disability is a person's neurological reserve. Neurological reserve is the capacity of the brain to compensate for subclinical lesions, or lesions that have no outward symptoms, and to recover from relapses. This reserve acts as a buffer to compensate when an area of the brain is compromised. Everyone has a different amount of neurological reserve, but as it gets used up, a person will experience a larger symptom burden and may not recover fully after a relapse. Everyone has the ability to expand their neurological reserve, though. Ways to expand it include exercise, social interaction, good nutrition, and managing stress. Living as healthy a lifestyle as you can while not adapting fad diets does allow your brain to heal and recover function.
And when we think about this, exercise does not mean get up and going and running a marathon tomorrow or even just exercising or running a marathon one time. Really, we think about what is it, the type of activity that you can do consistently. So maybe if one day your mobility isn't as great or you're not feeling as good, it's being able to walk to the mailbox or walking around the block. And on other days when you're feeling better, being able to take on more when you can. And really the intentionality with movement is really important when we think about exercise, not just always having to do the most and the fastest and lift the most and run the furthest. It's more so what can you do that's approachable and doable and with intention.
It's important to note here that MS is not the only thing that's going to be straining your neurological reserve. Other comorbidities, things like diabetes, heart disease, as well as lifestyle concussions, falling out of trees as a kid, those things all have an impact on your brain health as well. So advancements in medical treatments for MS have also furthered our understanding of the disease. Before 1993, there were no medications to treat MS. Patients could use some pharmaceuticals to manage their symptoms, but were often told to just go home, get affairs in order, and stay comfortable. In 1993, beta interferons became the first FDA-approved MS-specific pharmaceutical treatment, the first disease-modifying therapies. These first drugs were based on the animal model of the disease, in which T cells were the main driver of the disease activity. It was good to have something to treat the disease, but the drugs were not completely effective, so research on MS continued.
In the early 2000s, Tysabri was introduced. It worked in a new way by preventing immune cells from crossing the blood-brain barrier. We think of the blood-brain barrier that acts as a security system for the brain. So if the cells with bad information couldn't get into the brain, the disease activity was greatly lessened. At this point, we started to understand that the B cells played a bigger role in the human model of MS, and research focused more on the B cells and as being the main driver activity in the brain. Today we have a new therapy called Ocrevus that specifically targets B cells believed to cause the inflammatory attack. More specifically, the Ocrevus targets the CD20 B cells specifically. There are now 15 different FDA-approved medications for MS therapies on the market, and several new ones are in the approval process.
On the screen you'll see we have a webinar on our website, mscenter.org/webinars, called A Deep Dive into DMTs. Dr. Timothy Vollmer did that, and that's a good place to start learning about all of the different DMTs out there. For more information and updates on the upcoming therapies, you can check out our education summits, which are available live or on our website, all of the past ones as well.
So where are we today? What we do know is MS is one of the most treatable diseases when it's caught and treated early. Because there are so many different treatment options, we really encourage people who are newly diagnosed to get more than one professional opinion about what treatment option is best for them. The different treatments that are on the market work in different ways. There's injectables, there's oral medications, there's infusions, and really what works best for everyone is, since MS is such an individualized disease, the different medications work differently for each individual. So having different options and opinions, and different professional opinions in particular, is really important when thinking about how to treat this disease in the early stages in particular. So as we think about this, who gets it? Who gets MS, Kelsey? What do you think?
So MS is more common in females than males. It's more prevalent further north and south of the equator. The highest incidence is in Caucasians, and it is typically diagnosed between the ages of 20 and 40. So all of these are just statistically where we see MS more often. In reality, both men and women have it. It's found in most places around the globe, in all ethnicities, and can be diagnosed at almost any age, including children and seniors. We don't know what causes MS. There is no MS gene, though there are about 150 genes that are being looked into for links, mostly having to do with vitamin D synthesis and immune regulation. Low vitamin D and smoking are risk factors, but really, someone can have all of the risk factors but not have MS, and some people may have no risk factors and still have MS.
So we consider MS to be a heterogeneous disease, and what that means is that it shows up differently and impacts every single individual with it differently. Some of the most common symptoms that we see, fatigue, heat sensitivity, numbness or tingling in limbs or other extremities, I guess those are all of our limbs really, vision changes, pain, muscle weakness, and some of them also deal with emotional cognitive changes. And what can be so hard about all these is that they can be just really variable and also very invisible to the world around them. So as we talked about, these invisible symptoms can be one of the hardest things to explain to people who do not understand MS, who don't have it or aren't living with it. You might feel fine one day, and the next you might experience fatigue or muscle weakness that makes it difficult to get around. One day it might be fine to walk up a flight of stairs, and the next it might be really challenging. And so this can be really difficult for people around you or others and support partners to know what to say, how to help, when to step in and when to step aside, because just the symptoms can change day in and day out. And I sometimes think people who aren't feeling it themselves have a harder time knowing what to do, how to step in, because they just aren't feeling what you're feeling day in and day out. And because of that, it can be really scary and confusing for support partners. too. So when you think about when someone's newly diagnosed and still figuring out what is MS and what isn't, it can be really messy and confusing. We always really like to talk about how MS can be really messy. I know when I was first diagnosed, there was a time when I fell and I had a hard time getting up and couldn't really get my thoughts together. Someone in the store was trying to help me out, and finally got myself together. I got myself up and told her that I have MS and sometimes I fall, and she started laughing because she thought that I kept saying that I'm a mess, I'm a mess, I'm a mess, not that I have MS. And I think it really helps kind of highlight just how messy the beginning process can be and how confusing it can be when we don't always know what's going on and what we're feeling. So sometimes when individuals are diagnosed, it can be really quick, and other times it can be a really long, drawn-out process. But when the diagnosis is confirmed, I think that's when it can get really scary and overwhelming. Really, I believe public perception, we believe, we talked about this in our class, is that public perception is about 20 years behind what it really means to be diagnosed with MS today. So what we think and what we see around us isn't always necessarily the reality of what it means to be diagnosed with MS today in 2019. Many people don't know what to expect from their disease or how to communicate what they're experiencing on both a physical and emotional level. We often talk about how the unknown in life is one of the most challenging things to sit with, and MS makes you have to face that day in and day out. You just do not know what to expect, especially in the beginning. It can be so overwhelming. It can be challenging to know what to ask for and to really know what you need. Often it's both the individual being diagnosed and the support partner's first times interacting with MS on a very intimate level. Support partners don't always know how to help, and that can be really challenging too. We like to think about giving each other some space and giving each other some grace to talk through what you can. It can get really overwhelming in the beginning, and if that does happen, take a break from the conversation, but make sure you come back and finish the conversation. And that's going to be helpful with communicating, because communication is key with figuring out what works for you and how to support others around you, and knowing it's a two-way street. And not being afraid to ask questions, but also not being afraid to ask for what you need. Compassion, humility, and humor. I think humor is really important to have, but it can be really challenging sometimes, are important. Every day can be different. But also finding out what works for you can take some time and probably many trial runs. Some days maybe you need to take a nap and your fatigue will be a little bit better. Some days you might have to learn to say no to certain obligations that are overwhelming or asking for help on certain days. But other days you might be able to push yourself a little bit more, and just knowing it takes time to figure out what days you can do that and what days you can't do that. So let's really think about what are some common misconceptions with MS. Is MS more common in Colorado, Kelsey?
We hear that all the time. There is a correlation between your latitude and risk of MS. There is a higher incidence the further from the equator that you get. However, Colorado is pretty average for how far away it is from the equator. So it's difficult to know exactly how many people in Colorado have MS because, or anywhere really for that matter, MS is not necessarily reported to one central organization. The doctors don't have to, count you exactly. So the numbers aren't broken down by natives or people who have moved here recently. So that's just a really difficult number to pin down. But it does not appear to be higher than the average that could be expected.
Another question. My mom's friend who has MS is disabled. Will I become disabled too?
The answer here revolves around two facts. The first is that, as discussed earlier, every person will experience MS in their own way, and it is influenced by a variety of factors. One of those factors is based on how long ago your mom's friend was diagnosed. 26 years ago, we had no treatments for MS, and the early treatments were not effective for everyone. We know that the earlier someone is able to go on a therapy, the more effects that therapy will have. So someone who was diagnosed 30, 25, or even 15 years ago will have a very different experience from someone who is diagnosed today.
What about this cure-all diet that I've heard about? Does that exist?
Unfortunately, there is no diet scientifically proven to modify the MS disease course. The only scientifically proven way to control your MS is with a disease-modifying therapy. We also, talk about being social and engaged are great things for your overall brain health. And when you're on a really strict diet, you can't eat things other people are eating. It severely limits your ability to go out to dinner with friends or, have people over for a dinner party. So it's important to think about all aspects of how therapy or proposed change in your life will affect you. One diet that has been researched, though, is the Mediterranean diet, and it's been researched in heart health and has been proven to have benefits there. So, everyone can benefit from a healthier diet, and the Mediterranean diet is not super restrictive, so it can help eliminate comorbidities that would worsen your overall health. For instance, things like diabetes, obesity, and heart disease.
Are all health concerns related to my MS now?
No, unfortunately, people with MS can have other problems as well. It's always best to have a healthcare team that you can reach out to, including a primary care physician and a neurologist who can help you sort out what is MS and what isn't, and will get you the help that you need. It's great to have a team before you need them so they know what your normal is, your stable and steady place. And that way when things start to go a little out of whack, you've got someone to call and they know what's different. It's also just important to talk to your doctor about any new symptoms that you've got or anything going on. So even if you don't think it's your MS, making sure that the doctor that you're seeing is aware of what's going on. And any lifestyle changes that you're choosing to make, diet, if you're thinking about a supplement or starting a new exercise program, those are all great things to discuss with your doctor as well. So for more information on these and other MS misconceptions, you can check out an Ed Summit presentation by Dr. Rob Gross from spring 2018 on mscenter.org.
And one thing that I often think about too is at the beginning, newly diagnosed isn't just the first 0 to 6 months. Newly diagnosed, it can take years to sort out. First 3 years to kind of sort out what is my MS, what is something else, and really try to understand what is happening, what is going on. We do know the inflammation process is the highest in the beginning when people are newly diagnosed, which bring them in with active symptoms. And so it does take some time for that to subside as well, and for us to kind of be able to sort out what is MS, what isn't, and get a better understanding of that too.
Absolutely. So the Rocky Mountain MS Center has quite a few additional resources available. Our website, mscenter.org, has an archive of all of our past programming, including all of our education summits, our webinars, and the digital copies of our Informs magazine. We will post a link in the description of this webinar and include it in our follow-up email for those of you tuning in live. It's a one-page document titled Answering MS Questions, and it's just a really handy thing to have to help explain MS to other people as well. All of our educational programs are free and open to anyone. You do not have to be a patient at the Rocky Mountain MS Center in order to partake in our education programs. Some of those programs are education summits, which are half-day conferences where a majority of our neurologists will present. I think on April 13th is our next one. We have 4 of the neurologists as well as a registered dietitian giving presentations. If you're in town, you can come to that. It's at the Anschutz campus in Aurora. If you would like to watch it on YouTube, it will be streamed live, and it will also be archived on the website for later. We also have an MS 101 class. If you are in person in Colorado, we do a 2-hour, much extended version of this class, and that's offered twice a month with an online option as well for those of you outside of Colorado. Our Conversations on MS program is a traveling program. We go to 8 different locations in the Colorado and Wyoming areas. We bring a neurologist. They have an hour and a half of just a town hall style question and answer. We also publish a magazine called Informs quarterly. You can get it for free, delivered to your mailbox or emailed to you. And all of these opportunities are announced on our calendar at mscenter.org or our Facebook page.
As we wrap up today, Every case of MS is different, and every single person and every patient's experience is really unique. No patient experiences the same symptoms in the same ways, which makes MS particularly difficult to help others explain and understand, and to help others really get what's going on. We hope that this webinar has helped you to understand the experience of a friend or a loved one, or be able to talk about your experience with someone else a little bit better.
Thank you, Alyssa. So we are going to open it up for questions now. If anyone has questions, please just submit them into the chat screen on your window. I'll leave it open for just a couple minutes. Looking at the list of people who are watching live, and I see a few familiar names, and I just want to say thank you guys for tuning in, spending your afternoon with us. If you have any additional questions that come up later, or if you're watching the archived version of this, please feel free to email education@mscenter.org, and I can help you out and point you to whatever resources that fit your specific circumstance. But it looks like we do not have any questions this afternoon, so thank you guys. Thank you, Alyssa.
Thank you, Kelsey. Appreciate your time. Thank you all for tuning in.
All right. Have a great afternoon.